Welcome to the 507th episode of the Jami Dulaney Plant-Based Wellness Podcast. My name is Jami Dulaney, and I'm your host. I'm a plant-based cardiologist and endurance athlete living in Southwest Florida. Welcome, and thanks for listening. I hope your heart is healthy on this Valentine's week. Happy Valentine's Day to your heart from me. I hope you are taking good care of your heart. The month of hearts, but always. Most of my career, I specialized in echocardiography, and I have dictated numerous reports and looked at thousands of echoes. And I'm just going to start with a little bit about what I would say. The left ventricle is of normal cavity size and wall thickness. We want the cavity size to be a certain size, less than 5.5 centimeters, and we want the wall's thickness to be less than 1.1 centimeter. Something you probably won't remember, but we want all segments to contract normally with an ejection fraction of 55 to 60%. The segments of the heart, the front, the side, the middle, the beginning, and the end are all associated with the coronary arteries that feed them. We can't see the coronary arteries on an echo, but we can see the heart function and attribute a dysfunction of a particular segment to that coronary artery. Ejection fraction is how much blood comes out with each beat. People think 100% comes out, but it's not. 55 to 60% is normal. Less than 50% is mildly reduced. 35 to 40% is moderately reduced. Less than 35% would be severely reduced. The next chamber I talk about is the right ventricle. The right ventricle should be of normal size and systolic function. The wall of the right ventricle is much thinner because the right ventricle pumps blood to the lungs to be oxygenated. The left atrium gives blood to the the left ventricle. The left atrium is of normal cavity size. We look for things like clots or densities in the left atrium, which would signify potential mass or a blood clot. The right atrium is of normal size. Again, we look for whether or not there might be a clot or a density in the right atrium. The inner atrial septum is intact. That is the segment of tissue between the left and right atria that is open at birth and closes when you take your first breath. Next, on to the valves. The aortic valve is the valve that lets the blood out of the heart from the left ventricle. It is tri-leaflet. It opens without restriction, meaning that it has 3 leaflets. It looks like a Mercedes-Benz emblem when it's closed, and then opens and somewhat like completely opens. Some of the population, about 20%, have only 2 cusps. It's called a bicuspid valve, and when it opens, it looks more like a fish mouth. The mitral valve lets blood come through the left atrium into the left ventricle. The mitral valve is of normal size. Sometimes it gets calcified. When people have kidney disease, it becomes calcified. Rheumatic fever, scarlet fever from yesteryear would cause thickening of the mitral valve leaflets. We want the mitral valve leaflets to be normal. When you have mitral valve prolapse, it means that the valve leaflets bulge up into the left atrium, somewhat like an umbrella. The tricuspid valve is usually normal. People that do intravenous drugs, that valve is often the one that gets infected. The pulmonic valve lets the blood from the right ventricle out to the lungs. Most often it is normal. You can actually live without a pulmonic valve. Some people are born without it. Again, people that do IV drugs can have it infected. It can be taken out, and people can survive just fine. We look at the ascending aorta, and we'll talk about that later. That is when the blood comes through the aortic valve into the ascending aorta. We look to see if it's dilated. That's a place where you can get aneurysms. Sometimes the aneurysm further on down into the aortic arch or descending thoracic aorta. We can't see that very well on a traditional echo. So the basic reason for doing an echo is to see how your heart function is currently. People that have arrhythmias can have a dysfunction of the left ventricle. Again, you can get infections on the heart valves that we can see with a regular echo, or there's another specialized echo called a transesophageal echo that we do with endoscopy. But we get a lot of good information about the overall function and anatomy of the heart. Again, we can't see the coronary arteries, but we can infer that there's a problem by the way the heart contracts. There's a procedure called a stress echo where we have people get on a treadmill and exercise. We actually do an echocardiogram first, capture images in those chambers, and then have people exercise on the treadmill and then quickly get off and re-echo to look to see if the left ventricle is functioning normally after exercise. And it's actually quite accurate to pick up coronary artery disease. Again, it doesn't show us the coronary arteries, but it shows us how the function and the blood flow is to the heart. It is a great test for women in that the breasts don't get in the way as far as attenuation that can be seen on a nuclear stress test, and of course there's no radiation. The reason why it's not used is because it is too good. You get too much information and you don't get reimbursed for it as a cardiologist. Medicare and the insurance companies don't recognize it as a highly reimbursable procedure, although it gives great information. So the nuclear medicine people, I guess, have lobbied more, and so that is a much more heavily reimbursed procedure. The other procedure, again, that you may be sent for is a nuclear stress test. If you cannot walk, there's a medicine kind that can be given to dilate your arteries. A lot of labs want to get people through quickly, and they want to do a medicine kind on everybody. That should be declined. If you are going to have a stress test, then by all means you should walk on a treadmill. It is to your benefit. If you can walk greater than 10 minutes on a Bruce protocol on a stress test, then your prognosis is excellent, regardless of the rest of the images. So ask questions. If people aren't willing to work with you, then be sure that you find someplace else. The other thing is when people do a stress test, and for the nuclear images, really you start to get good information after you've achieved 85% of your predicted maximum heart rate. So that's 220 minus your age is a rough estimate. If a technician does a stress test, they'll often want to stop it at 85%. That's not in your best interest either, because you need to go until you either have symptoms or you can't go any further to get a really good idea of your functional capacity. And as we've talked, and we'll talk more about it today, your VO2 max is something that we want to have an idea of. You can't, with a regular stress test, you can't estimate a VO2 max, but the longer you go on a Bruce protocol, the greater your VO2 max is, and it's a good prognostic indicator. So don't let people stop the treadmill until you've had it, and you should push as much as you possibly can. A normal echo and a normal stress test by no means means that you don't have coronary artery disease or that you can't have a heart attack. Stress tests won't pick up a 20% blockage that could rupture tomorrow and cause a heart attack. So it's a good prognostic indicator if you're trying to figure out what the chest discomfort that you have is coming from. So again, people should be screened. We look at pre-test probability and post-test probability. If we do a stress test on a normal person, especially if you don't go to 100% of predicted maximum heart rate, then the ability to have a accurate test markedly decreases. So we get more what we would call false positive tests, meaning that there may be some slight abnormality on the pictures, and we're not sure what to do, and those people get referred for heart catheterization. They might find that there are blockages, and you might get a stent, but again, without any symptoms, there's no evidence that you will live longer or better with a stent than you would have without it, so you got to be really careful. On the other hand, if someone is having exertional chest discomfort, a stress test might be a good way to see where that problem is. And again, the functional capacity. If somebody is, again, looking to see where they are after they've had a heart attack, it's a good starting point to see how much people can exercise and exert themselves without having chest discomfort or abnormalities. It's a great way to follow up with people with a positive calcium score, because if you can exercise, again, 10 minutes on the Bruce protocol and your nuclear perfusion is good, then your prognosis is excellent, and doing a heart catheterization and stenting is not in your best interest. So get out and start practicing. If you're going to have a stress test, practice for your stress test. Unless you're having some chest discomfort that you're not sure about, then you should obviously consult with your physician. And hopefully you'll find one that follows rules like above. If you want to consult with me, be happy to do so. You can go over to drdulaney.com, check out our website, contact the office, and we do consultations and second opinions for people that are having chest discomfort or not sure what to do. Otherwise, get out and train your heart. I am back doing my running and ramping up my mileage and volume for the next race in a couple of weeks. It is called the Long Play. It's a 50K trail race. That'll be followed by, in about it's more than that, probably a little over a month, April 26th, another trail race called the Skunk Ape 50K. Apparently, a skunk ape is the Florida version of Saskatchewan man, or, one of those guys that walk around the woods. So hopefully I won't see a skunk ape, but apparently the trail is very beautiful up in Ocala area where there might see coyotes, bear, alligator, and so for Florida, it'll be a lot of wildlife, so that'll be cool. And then on to Cruel Joe, which is the A race for the spring in mid-May, I guess it is, May 18th, up in Georgia, and then we'll focus on Colorado. So I'm upping my mileage, and I've started doing speed work, and I'm having a coach dictate that to me so I don't do anything crazy to myself. But it's been a lot of fun to be able to pick up the pace finally after a year or so of kind of hobbling around with my ankle. So I'm liking to be able to do a little fast stuff. I am still doing 2 strength training sessions a week, and those are given to me by Nathan, who is available to give them to you as well. Nathan is our strength coach for the practice. And I have been following his regimen for over a year, and it's certainly paying off. Injuries are better, strength is better, and things are progressing good. I stay on track with my nutrition and my training because of the races that are on the calendar. And every week I start with looking at those races on the calendar and my running schedule and my strength schedule is laid out on the calendar. After I complete the workout, I write it in the calendar as completed. It's a priority for me. This weekend, I'm traveling to Houston for my granddaughter's first birthday. Happy Valentine's Day, Cecilia Joy. So Valentine's Day birthday. So my training schedule won't be as normal as it is planned because we have a special occasion. But that doesn't mean that I won't get out and do some exercise. And my plan is to push the training sessions before I go so that I've got a good training weekend so I can coast a little bit over the weekend and then pick it back up Monday. And, life gets in the way with exercise, and, we'll talk about that a little bit later as well. But it has to be made a priority and be a focus and something that you can look at and have reminders every day to make sure that it's scheduled and in your plan. Sometimes you have to make adjustments, but you can get it done. Yesterday was an example for me. I had a very busy day because I have a short week because I'm leaving to go to Houston. I had things come up in the office. I had things come up at the house. I got my morning speed session in. I had a strength session to do. I didn't get to the strength session until 8 o'clock last night. And I didn't really want to do it. I thought, well, I can put it off until Wednesday. Maybe I'll do half tonight. And so that's what I started to do. I thought, I'm going to do as much as I can starting tonight, and then I can finish it out tomorrow. But after I got started, I kept going down the list and checking exercises off. And it's like, I want to push it and get it over with tonight. And that way I can stay on schedule, have more of a recovery day on Wednesday, and then have a good session on Thursday. So I did what I didn't, necessarily want to do, but it was on the schedule, and once you get started, it's easier to keep going. With the speed sessions and the weight sessions, I come into the weekend for my long runs a little bit on the tired side, and Saturday is somewhat of a chore to get up and start the long run, and usually once I get going, I'm all right, but it would be easy to kind of get into a negative mindset, dreading it because I'm a little bit tired. I've done speed sessions during the week. But my rationale, which helps me to turn around, is that when I'm doing my 50 Ks and 50 miles and then 100 miles, I'm going to be tired. And so I better get used to feeling what it's like to run long distances, being a little tired in training, so that when it hits me during a race, I'm all right. And usually I'm just fine. It's more in my head that I think, oh man, this is going to be hard because I'm tired and it's the end of the week. And if you start out a session like that, it makes it a whole lot harder to turn around than let's see what happens and let's practice training on somewhat fatigued legs because this is the end of the week and it's supposed to be how it feels, and then Monday's going to be a rest day. So we all have to have these conversations in our head on why we want to do the things that we know is good for us and continue to focus on what our goals are, whether that's nutrition or training for a race. I asked in class yesterday what would make someone not go out for their morning walk or run, and somebody commented being tired. And again, tired is somewhat subjective. Is it legs tired, body tired, everything tired? Are you sick, or are you just fatigued from lack of sleep? The reality of it is, more often than not, when you actually get out and start doing your walk or your exercise, you feel better, and you certainly feel better afterwards. So don't let tired be the reason why you decide to skip a session. You're not injured if you're tired. You're just tired. And it's a really good way to practice being uncomfortable. We have to be a little bit uncomfortable, and then we gain confidence knowing that we can do things that make us a little uncomfortable. Whether it's going for a walk when you're tired, or not eating a snack when your belly starts to growl for the first time, or perhaps you're even attempting to do a water fast and going gets tough. Doing hard things is a really good mental training to be able to handle other mental things in the future. When you stress tired muscles, they become a little bit more fatigued, and then you rest and you recover and you become stronger. It's not unlike sourdough bread. When you stretch it, the protein bonds form and the bread becomes stronger. So we have to stretch into our uncomfortable zone in order to make any progress. When you're changing to a plant-based diet, it can be uncomfortable if you're in a situation where everybody else is not eating plant-based, or uncomfortable when you're traveling and it's not convenient to get food, or you don't want to make a big deal out of eating something different. But you have to get comfortable being uncomfortable if you're actually going to make progress. Becoming plant-based, I always say, is like learning a new language or learning a new skill. You have to know how to troubleshoot and be comfortable with making some choices and planning ahead, checking out menus, checking out where you're going, maybe grocery stores, and taking food with you if possible. But that comes with practice. And if you don't practice those situations, and you might not do it the best the first time, but every time you should learn a little bit from being a little bit more uncomfortable making those decisions, instead of just going off the wagon while you're or dialing it in and just eating, junk food that may be vegan. So try to up your game every time you're in a situation that is uncomfortable with food choices. Your friends and family will get used to the way you eat. Everybody adapts. It's something different. People adapt to having a family member with cancer. People adapt to a family member losing a limb. People adapt to having new family members. I mean, we are very, very adaptable in a very short time period. but something about changing people's menu makes people very uncomfortable, and they don't want to perhaps adapt themselves or wait for other people to adapt. But be strong, keep your convictions, and know why you're doing it. It amazes me when people are going on vacation and they go off the plant-based diet, or they eat poorly and they gain a bunch of weight, especially when people go on cruises. And the reason why people are going on cruises is to celebrate life and to be happy and to be healthy. But if you're eating unhealthy while you're on cruises, the chances of you getting to go on more cruises and do more things is limited, because you're accelerating your aging process, so to speak. If it's your last hurrah, then perhaps, but a lot of people will say this might be my last chance of doing something, when it's really not their last chance of doing something. You don't know that the majority of times. So that's not usually that's rarely a valid excuse for not sticking to your health plan and your goals for being healthy. I've heard people describe cruises as being a floating buffet, and I've never been on a cruise, but I've heard that there's food all around, and there's also other things to do, but people don't really talk about those. They always talk about the food. And so if you're headed out on a cruise just to eat food, and you want to be healthy, that's probably not the vacation for you. Gravity is going to pull people towards the more unhealthy, or the majority of what you see. So the majority of people don't think about this. They don't eat healthy. They don't exercise. So the gravitational pull is going to be that way, versus people are going to say, oh, you're thin, you look good, you're exercising, we want to be like you. What are you doing? I go down my street every day and nobody's ever said, hey, can I go for a run with you? It's some kind of comment about, crazy runner girl. But if you know what you want and you have written down and your health goals, then you have every right to stick to them, and more power to you to be healthy and to choose to be healthy. There's been a lot of discussion on dementia and Alzheimer's in the news, and a lot of the studies that have been done and a lot of the work is probably flawed. But we do know that more and more of dementia, Alzheimer's, is related to vascular function. And just like we talked about in the beginning of the program, your heart is the beginning of your cardiovascular fitness, and then your blood vessels. And the big blood vessels, the aorta, goes to the carotid, and the carotid goes to smaller vessels in your brain. They go to smaller vessels and feed your brain cells, as well as the electrical connections that connect all those cells together. And there's probably a huge vascular component to that. Diabetes, being overweight, hypertension are all risk factors for cerebrovascular disease as well. So our heart feeds our brain blood, but the brain is also responsible in our autonomic nervous system for regulating heart rate, regulating lymph movement, adjusting our blood pressure, and carries a large metabolic demand. Our brain weighs 2%. It's 2% of our body weight, but it demands over 20% of our metabolism, and it runs almost exclusively on glucose. People that go into ketosis, ketone bodies are emergency fuel. They're the backup generator when the brain doesn't have glucose. But the brain runs on glucose, and that's why people need cheat days if they're ketotic or carnivores, or they need a little glucose, because the brain just doesn't function as well. And we don't have any studies on people long-term over many, many years being in ketosis and how that ultimately will affect their dementia. But we do know that endurance training accumulates over the years to improve blood flow to the brain and vascular health in the brain, and can actually stave off aging and dementia. And the earlier you start to do endurance training, cardiovascular aerobic work, the more your brain is protected. So if people wait until they have dementia to start cardiovascular training, they're not going to have much in the way of reversal. On the other hand, if the symptoms, and people have vascular changes 20 years before they have symptoms, if you start cardiovascular training early, you're less likely to have the development of dementia and Alzheimer's. The better VO2 max that you can achieve, and continuing to exercise to maintain your VO2 max has been associated with decreased all-cause mortality as well as decreased cardiovascular mortality. But it's also been associated with the stiffness of that aorta that we talked about earlier, as well as vascular stiffness in the brain and how the brain regulates blood flow. So the better your VO2 max, the more continuous, consistent you are with cardiovascular exercise, the more likely you are to maintain good vascular health in your aorta, your carotids, and in your brain. Exercise also releases neurotropic factors that cause brain growth, neuron survival, better connections, but also helps to decrease stress and depression by mitigating inflammation in the brain and regulation of brain hormones. So again, multiple reasons to do daily cardiovascular exercise. As we age, we start getting shrinkage of our brain, especially in our memory areas such as the prefrontal cortex, and this especially an area called the hippocampus. And frequent cardiovascular exercise, sustained endurance training has been shown to improve perfusion to the hippocampus and to improve memory and cognitive function in people that are mildly impaired, even after 6 months to a year of continuous training. And what I'll stress is not intermittent, but continuous, built upon training over a prolonged period of time. So going out for 6 weeks and exercising 3 days a week and expecting to get improvement and then sitting back is not going to make a difference. And I think that's a lot of what is been marketed in our society, that we can do a quick fix, lose 50 pounds and everything will be okay and we can go back to doing what we're doing and coast. We can exercise 2 or 3 days a week, walk the dog, let the dog sniff, just do this moseying around and things will be okay. We're fooling ourselves into thinking that these minimal efforts are going to result in maximum change, and then just people throw everything under the bus and say it doesn't really matter, you can't change it, blah, blah, blah. I don't feel good, I'm too tired, it's too late, and none of that is actually true. 1 year of continuous walking was shown to increase the hippocampus volume in people that were starting to have decline. So how do you do something for a year? You have to document what you're doing every day, and it has to be a day-to-day type of a program and a menu to stay on top of things. Not when it's convenient, not when the weather's good, not when you're not on vacation, not when you're not traveling. It's got to be part of your routine. The other thing that happens when the aorta gets stiff is that it causes a dysregulation of blood flow to the brain. So if you think of the aorta as being a hose, and you're born with a very compliant, soft hose that expands and contracts quite easily, when the heart beat and blood is ejected into the aorta, you have a systolic increase in the pressure of the hose, and then it relaxes. So it distends and then relaxes, and you have a diastolic pressure. That's our systolic, the top number of blood pressure, and the diastolic, the bottom number. As we age, or you have progressive vascular disease, the aorta becomes very stiff. And so that top number starts to go up because it's not compliant. So it's beating into, or the blood is ejected into more of a plastic pipe versus nice, smooth, distendable rubber hose. And then it can't relax, so the blood pressure just falls very severely. So if a normal blood pressure is 120/70, the first thing that happens is people start to creep up, 130/80, 140/90. So the blood vessel is not as distendable. The number goes up, but it also doesn't recoil nicely, so the top number starts to go up. And then it becomes so stiff that nothing happens, so you just have this big first number, 160, 170, and then it'll go all the way down. The bottom number will be good at 30 or 40. And some people might think that low bottom number is good, but it's actually bad, because now we're going to try to perfuse our brain, and that big increase of pressure at first is damaging to the arteries and the small arteries in our brain and our blood vessels. And there are also things called baroreceptors in our aorta and in our carotid that adjust blood flow. And we have an abnormal blood flow to the brain, and again, a progressive over time, beat to beat, minute to minute, hour to hour, day to day change in blood flow to the brain. And you can understand now why things start to shrink and not behave normally. When someone has a stroke, we actually have to maintain their blood pressure higher in order to be able to perfuse those brains, and it becomes a very slippery slope. You don't want the pressure too high to cause those damaged blood vessels to bleed. On the other hand, you have to get blood flow to the heart through this increased vascular resistance. So what do you do today? Today, you go out and take your first walk. And if you've not been out the door, start with 10 minutes out, 10 minutes back, easy pace, conversational. You should be able to say the Pledge of Allegiance without having to skip. I pledge allegiance to the flag. If you can't and you're breathing heavily, you're going too fast. So slow it down and do something that you can. Have good shoes, good socks, so you get out 10 minutes out and 10 minutes back for a week without getting blisters, without getting pain in your feet or your legs. Discomfort's okay, but you want to be able to keep going day after day. Increase it 10% a week, and then change your diet. Increase your greens so that you can improve your endothelial function. All these are things that we address in our practice. Nutrition, full-time registered dietitian, strength training, cardiovascular exercise. We like to give people programs. We have wellness challenges. We'd like you to be a part of our practice, and we'd like to help you have a great Valentine's Day this week, as well as Valentine's Day for weeks and years to come. So go on over to Dr. Dulaney and check things out. If you'd like to become a member of our practice, there's multiple ways to join. And I hope you have a good Valentine's Day and focus on your health down the road as well as today. So do something healthy on Valentine's Day. Perhaps go for a walk. Make sure you're having greens in that Valentine's Day dinner, low on the fat end of things, and be happy that you're healthy and your family and loved ones are healthy. Thanks for listening. As always, email me at Jami, Jami, @drdulaney.com with any questions. Talk to you next week.